Systemic racism in the medical system, of course, is all too common for Indigenous patients. Now, a pair of University of Calgary researchers have drilled down into racial bias among Alberta physicians. For more, Daryl Stranger spoke earlier with Professor Pamela Roach.
Pamela, thank you so much for joining us here. First off, why don't we just start with what led you to initiate this research into anti-Indigenous racism amongst physicians?
Yeah, absolutely. So we know that we hear lots of patient stories around anti-Indigenous racism within the healthcare system. I think one thing that happens is it's really easy for people who work within the system to try to say they don't know where it's happening or they can't see where it's happening, and they think they're not racist and their colleagues aren't racist, but these things continue to happen. So we thought, well, the best way we can try to address that is to actually ask physicians, if they have biases. So that was the driver, because I think then we can't look away from it. It highlights if people are telling us where it's happening, then we have a duty to respond to that.
So then, Pamela, which methods were used in the study to gather the information, and what was the response like as well?
Yeah, so we sent out the survey to every practicing physician in the province of Alberta. So there's about 12,000. We had about 1,100 people reply to the demographic survey. And then within that, we asked 2 explicit bias questions around anti-Indigenous bias. The first one, they were both slider questions where you would have to click onto your screen and actually slide a little bar to the left or the right. The first question asked, do you feel unfavorably or favorably towards Indigenous people? We had about 375 people answer that question. And then the second question asked, do you prefer white people or Indigenous people? And that first question around favorably or unfavorably, about 8% said they feel unfavorably towards Indigenous people, and about 25% said they prefer white people over Indigenous people.
Wow, okay, that's super interesting. So just given what you just said, Pamela, what were maybe some of the most surprising findings and comments? And further to that, why is this damaging to Indigenous patients?
Well, I think it's what was surprising. Maybe perhaps we'll start there. I'm not surprised necessarily by those attitudes. They don't surprise me. I think based on what we hear from Indigenous patients all the time, it's not surprising. I think what surprised me was the level of honesty and candor that came back. We kind of thought that if we sent these survey links through work-related email newsletters, that people might respond in the way they think is socially acceptable. But through those answers, and then also we had a comment box, and through some of the comments that were left, it was quite hurtful, to be honest, and surprising to see just the level of honesty that was coming through there. And I think part of the reason why that is so important is it really demonstrates how confident some of these physicians were in expressing their views. And so if those biases exist even before Indigenous patients walk through the door in really vulnerable times of their lives to seek help, then that will have a huge impact on patient care.
And lastly here, what should happen now going forward?
I think what this does do is it really creates a need for accountability. So we know that there's education, there's some mandatory education, there's lots of other types of education that are being developed, which are really important. But the people expressing some of these really extreme explicit biases won't necessarily be the people who are engaging in that education. So what we need to then think about is, how do we hold people accountable? How do we hold the system accountable? And building some really robust, strong policies and procedures for when these things are reported and they happen, what happens next, and making sure that we're accountable to Indigenous patients to make that better.
Well, Pamela, we'll have to leave it there, but we certainly appreciate you coming on and updating us on the research, so we really appreciate it. Thank you so much.
Thank you.